Welcome to Startup Health Now, the weekly webcast that celebrates the healthcare transformers and change makers reimagining healthcare. My name's Unity Stoakes, and today we're having a conversation with Schiller, the co-founder and CTO of Validic. We're going to be having a conversation with Drew about the power of pivoting and all things interoperability in healthcare. Stick around, it's going to be a great show.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. Well, I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Drew, it's great to be speaking with you today.
Absolutely, yeah. Thanks for having me.
We're at Health 2.0. Do you come to Health 2.0 every year?
Yep, every year since 2013. This is my third year in a row.
Okay. What do you hope to get out of when you come to a conference like this?
Yeah, so a couple things. First, it's great to reconnect with a lot of people, such as yourself. And actually, Health 2.0 2013 was sort of inadvertently our coming out party. So this is our first conference we ever attended and sponsored and had a booth at. And that was a really big experience for us with a lot of customer interest, a lot of partner interest. And so really what I look for is just starting some good conversations and continuing the ones that we're already in.
So, and that's a good way to back up, because I want to hear about the mission of Validic and really what you guys do, and especially for the audience that may not be familiar. What's the backstory? How did you get started, and what's the mission of Validic?
Yeah, sure. So what Validic does today, it's the leading digital health platform for connecting patient-generated data from digital health apps, wearables, in-home medical devices. And what we do is we standardize and normalize all that data and provide one connection to the health systems. So these are hospital systems, insurance companies, pharmaceutical companies, wellness companies who are looking to get access to patient-generated data from, glucose meters, blood pressure monitors, of course, the wearable trackers, anything like that. And so to your question about how we got started, this actually isn't what we were trying to do. We were actually initially...
So shocker, you started doing something else.
Yeah, exactly, right? And so what happened was we were building a population health management tool, primarily for the corporate wellness space, but really just more in general for disease state management. And what happened was we realized that there's no way that we could get scale fast enough by building all of the programming options in ourselves. So we decided to integrate with other programming options that were already available. So this was back in 2012 that we started doing this. And we were looking at Fitbits, we were looking at Runkeepers, apps and devices like that had APIs. And we built an early version of that system. We were way behind in our development because the integrations took so long. We couldn't believe how long they took. And we took an early version of that product out to the market, and everyone said, wow, this is really great. How are you getting all this data? And we said, well, we built all these connections, and this is what we're going to do with it. And they said, yeah, okay. So you can get the data from all those devices and bring it into our database? And we kept having all these conversations, and everyone kept going back to the data and that they wanted access to the data. And finally we said, well, couldn't you just build the data yourselves? And they said, no, what we do is the engagement piece. What we need is the data, And so we recognized was that if we could fill this need and be the data connector for everybody, then it would actually help every company who's looking to do something with the data start with a robust set of devices without having to build each one individually. So we pivoted, and the rest was
So how many
history.
years did it take, or how long did it take to get to that moment where you saw the need that you just sort of knew, hey, this is what we got to focus on?
Sure. So we started the company in early 2010, and so that was with our first product that we then learned from that and pivoted to the second product, which I just mentioned. It's the population health management tool, and with that product, it was about a year of building that and working on that product, raising money around that product, and then it was the strangest thing. We had an idea. It was just this day we were actually taking meetings in California, my co-founder and I, and we were talking with a couple people, and they said, both of them happened to say, the data is what we're really interested in. And we said, so if we took away all this other stuff and just gave you the data, would you buy it? And they said, yes. And so we were driving up the 101. My co-founder and I looked at each other, and he's like, do you want to say it or should I? I said, we got to pivot. Like, it's so clear. And so
there was a moment.
There was a moment, and I remember it. And we actually had already bought a marketing piece to, the challenge that we had is we had raised a bunch of money on this other idea. Right. We had sold investors on the idea. We got everyone excited about the idea, and it's actually still a really cool concept. But so we couldn't just trash it and move on. Like, we had to actually, bring everyone else along. And so we had already pre-bought a marketing piece that was scheduled to go out a couple weeks later. And we said, well, hey, to our investors, we said, look, here's what we're going to do. This marketing piece we already bought, we're going to try this new idea with it and see how it goes. And so we had like a couple weeks, so we came up with the name, the website, the logo, like designed everything.
You sprinted in action.
Sprinted in action, like built the whole thing, and we still didn't even actually have an API. We spun out our own internal API, so we knew we were going to do an API, but we didn't actually even have it live. And we just sent out an email blast that said, the future of preventive medicine is in wearables and patient generated data, and had a video around it, and the response was overwhelming. And so that's when all our investors said, okay, well, clearly this is what we need to do.
So how does an entrepreneur, you've taken money from a group of investors and you're thinking about pivoting your idea. How do you go to your investors? What do you do? What's that conversation like when you're in the moment?
Yeah, so it's a little uncomfortable because, like I said, they're sold, they're bought in. And so what we did was we said, here is what we're hearing from customers. So we brought it back to
focus on the market.
Focus on the market. This is what the market is telling us, and here's why we believe this is right versus what we were doing before. And if you have good investors and good advisors, they're going to push back because that's what they do. They challenge you. They really want to make sure you're thinking through things correctly. So we answered a lot of very uncomfortable questions, and some of the questions we didn't even have good answers to. We knew in our gut that this was the right thing to do, but there was really no way around it. So what we did was we presented them with as much evidence as we could muster, and then for everything else, we said, look, we're not saying that this is what we're doing definitively. What we're saying is this is what we think we need to try. So here is the steps that we're going to take to try it, and here's the metrics we're going to use to measure it. And if these don't pan out, we will continue doing what we were doing before because it's something we still believe in.
Yeah, I think you got to have that sort of backbone as an entrepreneur and stick to what you believe in, right? Especially when you see the market telling you something, right?
Yeah.
So when did you decide to become an entrepreneur? Let's back up into your personal journey and story. Was there a moment when you knew that you wanted to be an entrepreneur?
There wasn't a single moment. It's something that inadvertently I've been doing my whole life. So when I was a kid, I discovered in Corel WordPerfect that you could do columns, and I could make like a newspaper-like thing on an 8.5 by 11 sheet of paper, and so I started a neighborhood newsletter, and started trying to sell subscriptions to my neighbors on that. And then when I was in high school, I was in a brass quartet, and I started like getting us to gig around town with our brass quartet that we were like winning state medals, but then I was also like trying to earn some money on the side with it. And so when I was graduating college, I never thought about getting a job. I always was just saying, I even had clients for web development and graphic design when I was in college, and I never once thought about applying for a job. I only thought about what I'm going to do to grow the business once I graduate. So I've just always been somebody who wanted to work as an entrepreneur independently.
Yeah, that's fantastic. So you've just raised a big round a few months ago with Validic.
Yep.
Maybe talk about that process. What was that experience like?
Yeah, sure. So there was $12.5 million from Kaiser Permanente Ventures. And what I will say is this was our Series B, and this was the easiest round that we've raised. And
why do you think that was?
Well, so the reason is because for our Series A, we had a lot of investors that we talked to, and there was 9 months between our Series A and our Series B, which is a very short amount of time. In that short amount of time, our valuation increased substantially because of a lot of customer relationships that we were able to and customer traction we were able to get due to the Series A. So what we did was, for all of the relationships we had already developed at the Series A, we kept those warm, knowing that sometime in 2015, we were going to do a Series B. And when it came time to the Series B, my co-founder and I looked at each other and said, we don't want to do another roadshow if we don't have to. Let's try to raise this internally amongst our network. And so we started just circulating it. We made a deck. We started circulating amongst people who were interested in the Series A.
And this is with the new pivoted idea?
That's right. Yeah, this is with Validic. Yeah, and so this was, but in this amount of time, we had closed WebMD and Cerner and Weight Watchers and Meditech.
So the business was still growing.
Business is growing like crazy, and so when we went out to raise the Series B, what we did was we just circulated a deck to the people who we knew and the conversations that were warm, and we said, here's what we did with A. And now here's what we're going to do with B. Like this, we said we were going to do this with A, and you saw it. Now here's what we're going to do with B, right? And so the best thing that an investor can ever have is when you say you're going to do something, and you do it, then they're much more likely to then say, okay, I believe you now. I'm going to go do this. We were sitting and we were talking to an investor who really wanted to participate in our A, and they weren't able to because of political things inside of their organization. One of their partners didn't understand our business very well, and so they weren't able to get it done. And before our Series B, it was not somebody who ended up investing in our Series B, but before our Series B, we were talking to them, and they said, well, gosh, for your Series A, like you did this, and you did that, and you did this, and you did that, and we looked and we said, well, we told you we were going to do that. Like, I don't understand why you're so surprised. Like, this is exactly what we said we were going to do, and then we just did it, right?
So then you had some trust and validation and credibility built in
exactly
with those investors.
Exactly. I would say the hardest thing for a startup to do, though, is go from a seed to a Series A, because the lines are kind of blurred, and
especially today with the seeds being much larger.
Exactly. Like, I see folks going for a $2 million seed. That's going to lead to a big A down the road, but what's the metric? When do you do that? It's a really the early stage fundraising is really difficult to track those milestones, and so I think the best thing you can do for an A round is to start the conversations early, but make sure that you have really clear traction metrics around exactly when you're going to raise, so that once you're ready, you can go to them and say, look, I told you I was going to raise money when we did this, and I did it in the same amount of time that I said I was going to do it in, and now I'm going to raise this amount of money for that. So you just really give them some definitive things to wrap their minds around.
So tell them what you're going to do. Go do it. Keep building the relationship the whole time.
Yep.
And then go back to them when you really want to do it. Yeah. So what other lessons for entrepreneurs through that journey? It sounds like the ongoing relationship's key. It sounds like the doing what you say you're going to do and having that validation and credibility is key. You also had some traction. You guys were executing.
Yes.
You guys were getting customers. You guys were building a business. You focused on narrowing, I guess, the focus of your business, right, to something that you saw the market needing. Any other lessons learned, either things that you did really well or things that you would do differently through the fundraising process?
Sure.
That could be helpful to other early stage companies, entrepreneurs today?
Yeah, it's a really big question, important question. So one thing I would say that we did really well, and it was somewhat intentional, but also somewhat lucky, is that we stayed laser focused on exactly what we were doing, and there were investors who were asking us, or telling us we should probably look at getting into analytics. There are investors who are telling us, hey, you probably need to get into the EMR space. There are investors who are telling us we need to do a lot of different things. But we believe, and we're seeing it happen, that the future of healthcare is in patient-generated data. It's in all the data that happens outside the four walls of the hospital. I mean, 99.9% of your life is spent outside a doctor's office. That data should matter, right? And so that's our entire company's focus. And a lot of our investors or of the investment community just didn't get that. The other thing that
So they were trying to maybe steer you in a different direction?
Exactly. And the other thing that they didn't understand fundamentally, Validic, when we think about ourselves in the market, we see ourselves as a marketplace. So we have the largest number of apps and devices connected, the Fitbits and the Omrons and the A&D devices, the J&J glucometers, all that kind of stuff. And then we have the largest number of healthcare customers. And so it's really hard to start a marketplace. Like think about, when eBay started, like getting all the buyers and all the sellers going, it's really hard. But once eBay got the wheels in motion, all of a sudden you have a defensible marketplace that's really difficult. And so a lot of these investors didn't understand that we were building a marketplace with that network effect, and they didn't understand the importance of that network effect. And so they just kept saying, well, there's no way that Validic can be defensible. There's no way that somebody else couldn't just come along and build the same thing you guys have built. But now that we have device partners coming to us, and we're the only way that they can get that their data flows into the healthcare system. And we have massive companies, Cerner, $25 billion market cap, using us to get access to all that data. So it's the network effect worked, and now we have the largest network for delivering this digital health data. But the investors, like convincing them that was the right idea was really hard. And so we just focused on the few investors who did understand that.
That's a key point there.
Yeah.
So when you find an investor that just doesn't get it, do you keep trying to convince them, or do you go try to find someone who shares the same vision?
Yeah, so if we did make one mistake, it was trying to convince the people who weren't convinced. And we wasted a lot of time talking over and over, trying to convince people who just didn't seem to get,
you're right.
Because we know we're right? But there's a saying from an old marketer who I love. I'm blanking on his name right now, but he says, "Is it better to be right, or is it better to be rich?" And you can be right in a conversation, and the other person doesn't see it. But you shouldn't waste your time trying to convince somebody of something they're not going to believe.
Right.
So just go find the people who do believe in what you're saying.
Yeah, no, valuable lesson there. So shifting gears a little, where are things going? There's all this data, which you guys are organizing. You're seeing the Fitbits of the world go public. Consumers are adopting these new solutions. Businesses are as well. Where does this all go?
Yeah, sure. So I think that what we're seeing, Mark Cuban, who's one of our investors, calls this the consumerization of healthcare. And we're hearing that term a lot. I think personalized health is really where all this is going. Now, what does that mean? So I think that the Fitbits of the world, what we know of today as the wearable devices, it's just the very, very beginning, just scratching the surface. I think that a lot of these devices, first and foremost, including Fitbit, are going to get much more into the clinical space. So, for example, we're already seeing heart rate being.
So they're becoming healthcare companies.
They're becoming healthcare companies, exactly. So we're already seeing heart rate baked into a lot of these wearables. We saw it with Fitbits. We see it with the Apple Watch. I think that there's a new thing that we're going to start to see next year called pulse transit time, and it's the amount of time it takes for blood to flow between 2 points in a body, which you can also get with a light sensor on your wrist. And so what that gives you is in a really close proximity to blood pressure. So we're going to start to see all these devices looking at real-time blood pressure data. So
and
now
we have a company called Oxytone. It's a wireless pulse oximeter.
Yeah. So great. So now you have pulse oximetry, you have blood pressure, you have heart rate. You're going to start to see some non-invasive glucose measurements, and all of a sudden you have really the core for measuring a person at any given interval. And there's no stigma around it. Like you're not sitting it's
happening invisibly, passively.
Exactly. You're not. So I know people who have diabetes, and at the end of their meal, once you're hanging out for a while at a restaurant, like they take out their kit and they have to take their glucose, and it's a little awkward. It's a little uncomfortable for them, right? But that's what you have to do. And so I think that with these wearable devices, it's going to be something where it's really passive, and it's something that they don't have to worry about, having a stigma around. I'm actually really bullish on the fact that, everyone's going to have a wearable. It could be measuring any number of things about you, but it doesn't matter what it's measuring about you, because everybody has one that's measuring something.
Right. So what does this concept interoperability mean in this world that you're creating?
Yeah. I laugh because it's like this buzzword of
Right.
like we have to define it because it's become almost so like meaningless in its overuse. So for me, interoperability for me personally really means data liquidity. It means that data is available to flow. And so what we're doing in
And even to the consumer.
And even to the consumer,
or especially to the consumer.
I would agree with that, especially because it's ultimately this is the consumer's health that we're trying to improve, right? And so, for me personally, what we are trying to do at Validic is make sure that all of the data that's being created now, again outside the four walls of the hospital, is not encumbered with the same challenges that all of the data that's currently inside the four walls of the hospital has. So what I mean by that. Today you have, I'm in Durham, North Carolina. We have Duke, we have UNC. Both have Epic installs that have been installed within the last 18 to 24 months. Neither of them talk to each other very well.
Right.
Actually, they don't talk to each other at all. They're both Epic. They're 8 miles down the road. I mean, you could literally print out a file and drive it down the road faster than you could get the two electronic systems to talk to each other. And that's a challenge that the current health systems have in interoperability. What I want is in the digital health space is for data to just flow freely. And if you want your Fitbit data to go to a specific provider, or if you want your mother-in-law, for example, for her blood pressure. I'm speaking about myself in particular. My mother-in-law has hypertension. I would love for her blood pressure data to be available to my wife and myself, so that we could help monitor and make sure that she's actually taking her readings the way she's supposed to, and that it's not spiking in any way that we should be concerned about. So, I think that world of interoperability, of actually making sure that the data is flowing in a way that's helpful for the patient, that's what we're really looking for.
That's great. So, and what are you most excited about coming up?
Oh man, that's a very general question. I would say.
Let's narrow it down.
Okay.
How about in terms of health innovation, in terms of just the ecosystem overall? You already said you're bullish. You've got this great opportunity with where you guys are as a company. It seems to be moving in the right direction. What happens over the next 2-3 years?
Yeah. Okay. So what I'm most excited about right now is that, what the future implications of this mean, the fact that we have the world's largest consumer electronics companies dropping hundreds of millions of dollars into this space. So Apple, Google, Samsung, Microsoft. Fitbit, with their IPO, they just had the largest consumer electronics IPO in history.
Yeah, it's like $11-12 billion company now.
Yeah, it's amazing. And so what I'm really excited about is all of these companies are engaging the patient in their health in a new way that's never been done before. So what I'm hopeful that the implication of that is that, healthcare has always been something that has been performed on a patient. And I'm hoping that now this is going to lead to something where a patient is actually taking a more active role in their healthcare and is actually participatory, which is really the ultimate goal that everyone's always wanted. So,
well, thank you so much. It's great to have a conversation with you, and glad you're from Iowa as well.
Yeah.
Another Iowan here.
Go Hawks.
Go Hawks. Thank you so much. Where can people find out more about you and Validic?
Yeah, so Validic.com, and we're also on Twitter at Validic. It's VALIDIC. And then you can also follow me at Drew Schiller.
All right. Thank you so much.
Yeah, thanks.
Thank you. We'll see you next week.